Hi, my name is Mohit. Kaushal. Today we'll be demoing how to change a chest tube dressing. So the first thing I'll be doing is just looking at the physician's orders and making sure I have all the correct supplies to change a chest tube dressing. And once I've gotten all my supplies, I'll be heading over to the patient's room. And upon entering the patient's room, I'll be doing an entry safety check, making sure call is in reach. Patient's in distress, there's no tripping hazard, and the bed is the lowest position possible. So once I've done that, I'll be doing hand hygiene, and then I can introduce myself to the patient. Hi, my name is Mohit Kaushal. I'm going to be changing. I'm a student nurse from University of Manitoba. And I'm going to be taking care of you today. I'm going to be changing your chest tube dressing today. And before I start, can I just verify your ID with the armband? Okay, perfect. Can you please state your full name and date of birth? Perfect. And do you have any allergies? No? Okay, that's exactly how on file. Okay, so I'm just going to be taking off your previous chest tube dressing and then cleaning the site, assessing it, and then I'll also be putting a new jelonet on it, reinforcing it with some drain sponges, gauze, and some mefix. Is that fine? Patient has given me consent. And also, before we start, do you also need any pain medications? Patient has said no to pain medication since their pain is well tolerated. So once I've gotten consent from a patient, I can reposition them. And then I'll make sure they are in semi-phalanx position with their arm elevated above their head. And then once I've done that, I'll also be putting them at hip level. But for demo purposes, we're gonna assume that this is hip level. But in real clinical setting, I'll be raising the bed till hip level. Okay, so once I've done that, I'll be doing hand hygiene. Now I'm ready to open my sterile tray. Making sure to only use the 1-inch borders. Grabbing my forceps. Okay, here's my drape. And I'll just be using this drape as a place where I can throw some of my garbage. Won't be needing that. Okay, now I can just add some of my supplies to my sterile tray. Here's some sterile normal saline. Here I have a 2x2. My jelonet. I'm going to be opening this up all the way. Just don't want it to flop all over the place and contaminate it. Okay, there we go. Without touching it. There we go. Just going to be putting that down right there. And then now I'll be adding my drain sponges. Okay, and that's it. So now that I've added everything into my sterile tray, I'm just gonna be doing hand hygiene, and I can don my clean gloves. Looks like I need a new pair of clean gloves. And I'll just be, in this case, if I didn't have any clean gloves, without leaving my sterile field, I'll just be going to go get clean gloves. My buddy nurse right here, you can just go grab me clean gloves right there. These clean gloves are ripped, so it's okay. I didn't leave my sterile field. Perfect. Thanks, fellow nurse. Okay, so now that I've done that, so first thing I'll be doing is just palpating around the site to make sure there's no subcutaneous emphysema. And as I can see, as I can feel, there is no popping underneath the dressing or the skin. So now I can take off the dressing. And while taking off the dressing, I'm also going to be stabilizing the chest tube, making sure I don't yank at it. Okay, so I've taken off my dressing right here. And once I've taken off the dressing, I'm also going to be noting the amount of odor. And there's no drainage on the previous dressing. And there's no signs of infection. So I'll be documenting those in my IPN and my wound care flow sheet after. So now I'm also going to be taking these off, taking off my clean gloves. I'll be doing hand hygiene again, grabbing my forceps. And now I can take off the previous jelonet. And I'll be discarding that alongside with the forceps. And now I'm going to be assessing the site. There's no erythema, there's no redness, inflammation, any signs of swelling, there's no signs of infection, there's no foul odor, and there's no drainage. So I'll be taking down those. And the peri-wound skin also looks fine. Everything seems to be healing healthy. And so I'll be taking those down in my wound care flow sheet, my documentation after. Okay, so now that I've done that, now I can start donning my sterile gloves. I'll be donning my right one first, so it's my dominant hand. And then I'll be donning my left one, using the cuff. Okay, so now that I've done that, I'm sterile, and now I can just fix my tray up how I want to. And now I can just start cleaning. So I'll be using 2x2s to clean. Using 2x2s to clean. I'm just making my rosette, perfect. Dipping in normal saline, and I'm going to be going one circle all the way around, perfect. I'm doing that again, but with a larger circle. Dipping in normal saline. There we go, another circle. And I'll be doing that one more time with a bigger circle. Perfect. Okay, so now that I've done that, I'm also going to be cleaning the chest tube now. Dipping in normal saline, and one swipe, clean. I'll be doing the same thing for the underside of the chest tube. Clean. Okay, so now that I've done that, now I can just dry the wound, and I'll be using 4x4s to dry, as they cover a bigger surface area, and so I also don't contaminate my forceps. Okay, so one swipe, clean. I'll be doing that one more time, and then I'll be doing that for the chest tube itself. Okay, clean, and then I'm also going to be drying the chest tube using 2x2s. Now I'm just going to be doing the underside of the chest tube now. Okay, now that the whole wound has been cleaned and dried, I'm ready to apply my new jelonet. So I'll be taking my jelonet, taking my skin, and then just sealing this around the chest tube itself. And as you can see, I have a nice seal around the chest tube itself. I have a nice seal around the chest tube itself, and I did not contaminate anything while doing that. Okay, so now that I've done that, now I'm going to be taking my drain sponges. Taking my drain sponges. And I'll just be applying these. Be applying these in different directions. So there's the first. Okay, and then there's a second. And then once I've done that, I'm ready to apply my 4x4s. Here's our first 4x4. My second 4x4. Before I do anything else, I'm just gonna press these down a bit. Okay, perfect. And at this point, I can consider myself unsterile. I'll be taking off my sterile gloves. Performing hand hygiene. And I'll be getting my mefix. So I'm just gonna be stretching my mefix out. First thing I'll be doing is just taking one part off. And then without touching the 4x4s, taking this one off. And just pushing it down, perfect. Now I'm doing that again, but this one I will be tenting it nicely around the chest tube. Perfect, and then just taking this off. And I'm just gonna be making sure there's a nice seal and tent around the chest tube. So if the chest tube does gets yanked on, it will be just the end portion over here, not the whole thing. Okay, so now that I've done my chest tube dressing, I'll be doing hand hygiene. I'll be cleaning up the whole patient's area, doing my exit safety check, making sure call bells in reach, patient sign distress, make sure the bed is in the most possible and there's no tripping hazards. Once I leave the room, I'll be doing hand hygiene again. I can just go document all the characteristics and the procedure and according to my facility's policies and procedure. And that's everything.